Hi, my name is Patricia McCormack. I am presenting to you infant mortality as a key indicator of healthy lives as per the National Scorecard on U.S. Health System Performance in 2011. Infant mortality is defined as the demise of an infant prior to their first birthday. According to the CDC, infant mortality is an important marker of the overall health of society. If you make it to your first birthday, the next increase in mortality wouldn't be until the 5th decade of life. This image shows the leading causes of infant mortality. The top 5 are birth defects, preterm births, pregnancy complications, sudden infant death syndrome, also known as SIDS, and injuries to infants. Healthy People sets the national objectives for improving health of all Americans. The quality measured for infant mortality rates is a decrease from previous year by state of preventable infant deaths. The rates are reported as the number of deaths per 1,000 live births. The goal is 6 deaths per 1,000. In 2017, 26 states met these objectives. The quality indicators are the leading causes of infant deaths, which are as presented here. The National Scorecard for 2011 indicates that the United States infant mortality rates are higher than other industrialized countries. In 2011, the rate was 6.8 per 1,000 live births. In 2017, the rate was 5.8 per 1,000 live births, which was a slight improvement. The decreasing infant mortality rate can be attributed to medical care advancement in the care of the preterm infant and medical management of maternal gestational complications. This alone proves that healthcare access is an essential factor in decreasing infant mortality rates. This graph from the CDC illustrates how infant death disproportionately affects minorities. The dark blue states on this map indicate the highest rates of infant mortality, as high as 8.6. What has worked to reduce infant mortality rates? Public health agencies have worked together with providers, communities, and partners through research, programs, and improving access to health care for pregnant women and children. This has contributed to the decrease in infant mortality rates, but this is not enough. Prenatal care, child health insurance programs, and reduced cost programs do not help women before they're actually pregnant. And insured women who have a financial responsibility, such as copays or deductibles, often cannot afford these and therefore avoid seeking medical health care. What's not working to improve infant mortality rates? Preventative care, wellness, management of chronic medical conditions, addressing substance abuse and mental health issues are all essential to ensure a healthy pregnancy and a healthy infant. What is affordable for one person may not be for the next. This is not just a request from the Congressional Committee, but a need for legislation on a national level that grants all persons within the United States to have free access to health care that would greatly decrease infant mortality rates by providing health maintenance, health management, and education to all individuals within the United States for optimal health and the best outcomes, not just for our infants, but for our society, our communities, for all Americans. Thank you. Thank you for taking the time to listen to my presentation on infant mortality rates.